Those pictures that were drawn by children is just heartbreaking as a parent, as a human being. I mean, what do you, when you look at those pictures, what do you see? What is your interpretation?
Well, as a child psychiatrist, I have a very strong understanding of child trauma, and images like this, not only are they very disturbing, it also bodes to what these children may be dealing with in the future if they are to get out of these situations. The effects of trauma can last throughout a lifetime. It makes children at higher risk for medical illnesses, mental health issues, symptoms of post-traumatic stress disorder, which include nightmares and flashbacks and re-experiencing symptoms. So they are in a very precarious and dangerous position being subjected to this kind of trauma. And it can have long-lasting effects. I think the beauty of what I do is that when you catch things early or when you identify problems early, sometimes the interventions are just small interventions, but they have an enormous effect long term. You can really alter the trajectory of these children's life by early intervention. So the best form of mental health treatment is early mental health treatment. And there's also now we're moving into preventive mental health. Yes, as we've seen with slavery, and it's been well documented in social science research, the trickle-down effect from separating families, it lasts for generations. There's generations of trauma to come when a child is being taken away from their family. So these children are going to experience not only the trauma from being separated from their parents and many of them having to serve adult positions and parenting roles, the trauma from that, and then the trauma from just everything that they've been through and what is to come. Number one, the diagnostic criteria has broadened, so kids who weren't diagnosed previously are being diagnosed. Number two, the age of the time of diagnosis is younger than it was previously. And number three, because we have greater knowledge of the condition, it's being diagnosed more efficiently. Exactly how much these factors are contributing to the rising rates remains unclear, but as this gets teased out, we'll keep you updated. It's incredibly frustrating. I have tried several times to get involved and treat these children and at least see them and at least document what's happening, but we are not given access. And that is incredibly, incredibly frustrating because many of us have practices. We're already seeing patients, and on our own time we want to do this, we should be allowed to do so. And we are the experts who understand what these children are going through, and we can help them, and we are willing to do it at no cost at all, but we're not being allowed to do that. So it's incredibly problematic, and it's very frustrating to be a physician who may be able to offer their services to help.
I bet, yeah. You can help, and that help is not being allowed right now. Just a persistent, horrible situation. Dr. Anandhi Narasimhan, appreciate you joining us. Thank you.
You don't want children to have more anxiety in the future or depression or suicidal thoughts in the future. So there are ways and there are treatments that are effective in preventing those things. So that gives me a lot of hope and resilience. I mean, children by nature are resilient and their brains are still developing. So there's a lot that you can do to make sure that the brain is developing in a positive way.
Thank you for your work. Good to have you on the program.
Thank you.
My pleasure.